Addiction is a brain condition, and the brain capacity of self-control of cravings is critical to recovery. This video provides a snapshot of how the Total Brain mental health and fitness platform empowers users to measure their key brain capacities, screen for mental health conditions, train brain deficits, including self-control of cravings, and objectively track what's working. Users undertake the Total Brain assessment and the proposed trainings that are based on their personalized strengths and deficits. These assessment insights and supportive trainings are a complementary adjunct to clinical treatment. The essence of the use of Total Brain in addiction is to help make the user's brain more effective and less likely to be hijacked by intense dopamine cravings at critical moments. Two factors in Total Brain are focused upon to help foster self-control of cravings. One, stress mastery, because the brain's primary organizing principle is safety first. So stress mastery focuses on switching from a fight-flight state into a more calm and flexible vagus state. And secondly, emotions drive the brain. Non-conscious and conscious emotional cravings hijack the brain and require an awareness of the triggers and personalized strategies to control cravings. So the user begins with a 20-minute Total Brain assessment of their 12 key brain capacities and a mental health screen. The profile of their strengths, deficits, and mental health flags are used to shape a personalized program that is complementary to their clinical program to control cravings and achieve recovery. A Total Brain assessment and training example could be, for example, finding excessive stress, negativity bias, a lack of cognitive flexibility, and poor social connectedness, and say coupled to a flag of ADHD. This would point to training stress reduction, positive affirmations, emotion awareness, boosting focus, and impulse control. The data so far in over 10,000 users in recovery programs around the country is that objective Total Brain assessment has been very useful to shape adjunctive intervention programs. And poor self-control, reduced executive function, and low resilience predicts relapse. Users particularly trained positive affirmations, possibly because that aligns with traditional 12-step programs. Immersive brain training for over 3 hours, over a month, significantly improved self-control. And training positive affirmations, stress reduction, and positivity resulted in significantly less addiction symptoms at the end of a month in a clinic, full-time in a clinic. Overall, the primary focus is about self-control of in-the-moment cravings. No one has a monopoly of wisdom about this. It requires a focused, personalized strategy to help someone stop drinking or any drug taking or any addiction when the craving converges with an enticing pressure moment and an intense need for a dopamine hit. We will provide videos, summary of brain-based information about what has been found to help rewire the brain to get self-control in those moments. Granular in-the-moment trainings include our task to break stress and cravings in 60 seconds. The visualization component of this training includes the most impactful, personal, positive affirmations and images that have been found to help. There are also in-the-moment strategies to delay immediate gratification of cravings. How to resist negative, derailing thoughts. To not give in to temptation. and immersive cognitive behavior therapy training using Total Brain's Thought Tamer will help to preload alternative context for those challenging craving moments, as will strategically thoughtful positive alternatives to addictive dopamine highs. Total Brain breath and mindfulness exercise will deepen the ability for self-control when it matters most, and provide an alternative way to relieve stress instead of using drugs, alcohol, and other addictive substances or behaviors. The user is encouraged to align Total Brain platform insights, training, and tracking with the input from their sponsor and their clinical support. So in essence, the user begins the adjunctive Total Brain approach with a 30-day challenge of an assessment and training that will generate new neural networks to enhance self-control. Total Brain reassessment monthly will allow an objective tracking of what's working and the extent of success. Immersive self-insight, training, and tracking effective habits of what works to not give in to cravings will increase the likelihood of converting the 30-day challenge milestone into a lifetime habit of sobriety and recovery.